I'm really excited to be here. I know when I was in your shoes, either as a freshman in college or whatever, or as coming to master's program, right? Everything seemed very far away, and my career didn't seem like something that was going to happen very soon. And so it was a little frustrating, a little anxiety producing. So I'm hoping a little bit of what we talk about today will help you alleviate some of that if you're experiencing it at all, but also maybe put some interest in you about HIV, about the 1917 clinic, because we'd love to see volunteers and more people in my classes, just saying. But let's go ahead and get started. So first of all, this is me, right? I'm the coordinator of health education at the 1917 clinic. And there is my contact info. Feel free to email me with any questions you have about HIV, safer sex, volunteer opportunities, internships, the class. So a little bit more about the 1917 clinic. We're really the only HIV clinic in the Birmingham area and some of the surrounding counties that serve people living with HIV. There is family clinic run out of Children's Hospital and Adolescent Medicine, but they serve primarily the adolescent population, and we serve the adult population. And really our mission is to provide our patients with all of the best comprehensive care that they could ever need. We are a one-stop shop for a lot of their needs, and what we can't provide, our social workers are awesome at connecting them to whatever else they could possibly need. So a little history about the clinic. We first opened in January of 1988, so this isn't too long after the first cases of AIDS were really seen in the bigger cities like San Francisco, Los Angeles, New York. So this is after we figured out that it was AIDS, first of all. It's no longer gay-related immunodeficiency, it's no longer the 4-H disease, but we had diagnosed it and termed it AIDS, acquired immunodeficiency syndrome. And of course, eventually learned that that was caused by HIV, the human immunodeficiency virus, right? Some of you may wonder why we call it 1917. And that also comes back to our history and our location. We used to be located at 1917 5th Avenue South. Now, back then, we had a limited number of patients. They all knew where we were. We didn't have to put a sign up that said AIDS clinic, right? And for good reasons, we didn't want to put that sign up. Those were the days where clinics were getting bombed for having anything to do with HIV, right? We've had protesters outside of our buildings. So when we moved to our current location, which is 908 20th Street South, we kept the name 1917. Our current patients already knew what we were, and it was easy for them to say, oh yeah, I'm heading down to 1917. And it created that anonymity and that confidentiality that so many of our patients and us needed back in the day. Now, when I say us, I mean 1994, I was, 6? So not me specifically, but the clinic itself and all of the patients that we were serving during that time. We opened a dental clinic shortly after in that location, and back then and even today, there are many dentists who don't feel comfortable serving people living with HIV, so having that additional service was very important to the overall health of our clients. We were one of the first locations to launch an electronic medical record in Birmingham. This was something we designed on our own and really used to foster the health of our patients and clients, and we also linked it to research, right? So one of the core tenets of the 1917 clinic is kind of this bench to bedside and bedside to bench research program. Everything that we learn from the bench, we try to apply as soon as we can to our patient care, and anything we notice from the bedside, from patient care, we're taking back to the bench and learning why it works, why it doesn't work, what's going on with our clients. We now serve over 3,600 individuals living with HIV. This doesn't count the HIV negative clients that we see for HIV testing on a regular basis or for pre-exposure prophylaxis. And it also doesn't count those folks who are mono-infected with hepatitis C, who, because we have some doctors who are very interested in this subject, have opened the doors to those folks who only have a hepatitis C infection as opposed to a co-infection with hep C and HIV. Now, we offer a lot of services. We said it was a one-stop shop, and it really is. I mean, if we think about a patient-centered medical home where folks can come in, feel very comfortable, get all of the services we need, we're just about there. I think we're filing those final papers to actually say that we are officially. But if you look at this list of services, I know it's a busy slide, but it's busy because we offer so much, right? Dental clinic, dermatology clinic, endocrinology, liver, neurology, oncology, palliative, social, psychology and psychiatry, women's health, and those are just the clinical services, right? We also have a chaplain on staff who can provide spiritual support and support in general to our clients. Substance abuse treatment is really important. We have a dedicated substance abuse counselor on staff. Mental health counseling, not only psychologists and psychiatrists, but also certified counselors that can provide great services. Nutrition, medication, case management, and social services. We just had to hire, I think, 2 new social workers, bringing our current number to 10. Because with 3,600 clients, that's a lot of people to serve and a lot of services that are needed. And they do fantastic work. We offer support groups, volunteer opportunities, educational opportunities, community outreach, and prevention services. And prevention services is really where I am. So I tend to manage the prevention, education, and outreach services at the clinic. And so this means I offer and teach the sexual health awareness through peer education course. If any of you need an elective and are interested in sexual health, of course I would highly recommend it. We also offer pre-exposure prophylaxis clinic. And for those of you who don't know what PrEP is, it is relatively new. But what it is essentially is 1 pill once a day to prevent HIV. And this is huge, right? This is a big deal. And so we found that it wasn't being offered in the state of Alabama, except by a handful of primary care providers that were really hard to identify and get in with. And we said, let's start a clinic. So I'd say about half of my responsibilities are managing that program, recruiting patients, enrolling patients, and helping them lead the responsible lives that they want to have regarding their sexual health. We also do HIV testing events. We've done testing events here, I think on this floor, probably. Condom distribution, I'd say we're probably the organization that gives away the most condoms in the entire state of Alabama. I order in batches of, I think, 10,000 every 3 or so months. And with the number of people that we're serving going up and up and up, those requests also go up and up and up. We also provide HIV and sexual health related training. So if you're ever interested in providing additional training on these topics to whatever group it is, we're happy to come out and tailor that education to you. It can be lecture-based, like this is, or it can be more participatory-based, or role plays, or whatever you want. But we're happy to work with you to provide those options. So one of my goals was to talk about why this is public health, right? Why is condom distribution, why is testing, why is education public health? And this may seem obvious to some of you, but when we really think about it, from 1981 until today, that's only a 35-year period that we're living with HIV. We've come a long way, but with 1.2 million people, at least, in the US that are living with HIV, and about 50,000 new infections every year, we still have a long way to go. Of course, if we were able to promote the programs that do the most good and that make the most changes in behavior and structural and societal changes, then we could see the end of AIDS. Of course, if we break it down even farther, the South really is home to 50% of all new HIV diagnoses. But we represent only 37% of the US population. Can somebody say health disparity? Right? This disparity continues into young folks. And I'd say about 25% of new infections in Jefferson County alone are to people between the ages of 15 and 25. That's significant. There's something going on. We're not reaching them. Why is their risk higher? Why is their infection rate higher? So the CDC, of course, recommends that everyone between the ages of 13 and 64 get tested at least once in their lives for HIV. Tests are easy. You can even swab your mouth and get a result back in 20 minutes. You can buy that test over the counter at CVS, Walgreens, and any pharmacy anywhere, right? Or you can come to us, you can get a little bit more sophisticated. We'll do a finger prick, get some blood, still get results in 20 minutes. Very accurate, very reliable. But promoting that testing, helping everybody get tested and learn their status so that we can go on to treat those who have it and help prevent new infections for those who don't, is public health. Speaking of disparities, we see a very distinct disparity in the African American population. 44% of new infections in the US are to African Americans. And this disparity worsens when we think about African Americans who may also be men who have sex with men. And young, right? The current HIV epidemic for young MSM in Atlanta has been compared to the epidemics in sub-Saharan Africa. We're clearly doing something wrong. And so public health is needed to change that, right? On both the local level here in Birmingham, here in Atlanta, and on the international level. And again, for youth, 1 in 5 all new HIV diagnoses in the country, right? Again, that racial disparity with over 50% to African Americans, and generally higher rates of infection for males, right? And about 92% of those among the male youth were a result of male-to-male sexual contact. As much as I love talking about sex and HIV and the South and feel like it's a great place to be, how the heck did I get here? As you probably noticed, I don't have a Southern accent. And I'm not from the South. I'm from San Francisco, one of those places where HIV was first found. The place that we designed our clinic after, San Francisco General Hospital. A place that is known for being highly inclusive and tolerant of individuals of the LGBT community. Why would I come out here where the work is so much harder due to stigma, due to economic disparities, due to whatever you want to call it? Well, the answer, to be quite honest, is very, very simple. I hadn't taken my GREs yet, and the application due date was late compared to other schools. Okay? I got my degree at Willamette University in Salem, Oregon. It was a bachelor's degree in psychology. For those of you who have a bachelor's degree in psychology and are now in a master's program, you understand why I enrolled in a master's program. It can be hard to find a job with a bachelor's degree in psychology. I was working at a periodontal office and said, I need to go back to school. Just not something that I thought I would do. But a year and a half later, I ended up here at UAB with my degree in health behavior, right? During that time, I took the SHAPE course. I was able to get involved with a lot of the faculty here. Specifically, I worked with Dr. Norton on some of her research projects. She's not here anymore, but I will say it's important to get involved when you can, right? And then I completed my internship, as we mentioned, with the 1917 clinic. And let me tell you, bachelor's in psychology, I thought I was gonna do research. I was gonna be a research assistant, and I was gonna do research all day, every day. And so when I got here, research all day, every day. I took that SHAPE course, and I interned at 1917, and I found that teaching and educating and being in practice was probably the most rewarding thing I'd ever done. I do want to leave you with this. So your success is what you make of it, so make it yours, right? It may not look the same as mine. Your path is probably going to be completely different. I know when I was sitting in your spot, I was looking at everyone else going, gosh, why am I not there yet? Why am I not successful? Why do I have so much student loan debt? Which you will still have even when you become a professional, sorry. But make your experience your own. Take what you need to take from the program. Take steps towards doing what you like. And if you find out you don't like it anymore, that's okay. Find something else. And that really is what I want to give you today. Make this program your own, right? Make your experience your own. And that'll lead to your success, no matter what it looks like. Thank you. Any questions? For those of you watching online, he was asking if we've ever been involved in clean needle exchange programs for harm reduction. Unfortunately, they're technically illegal in Alabama. So no, we don't. We do believe in them. We think they're a very, very helpful public health practice. And I'm sure if the legislature were to support it here, we would be all about it. But unfortunately, no, we're not involved at this time. Like I mentioned earlier, the pre-exposure prophylaxis clinic or PrEP clinic, that probably was one of the reasons I got hired in the first place, was to design that program. So it's my baby, and I'm very, very proud of it. I have about 55 clients enrolled right now, and we're looking to expand to bring on more clients. I don't really have results necessarily because it's not a research project. It's pure practice, patient-centered. Though I will say that of all of the folks who have come through the program, none are positive. You know, we've seen STIs, but chances are they weren't using condoms with or without PrEP, so we were gonna see those anyway. Or they would have gone undiagnosed because they weren't getting screened regularly. And we've also helped other folks get linked to other services. So right now I'm working off of a wait list. It's hard to get people in, but we're starting to become more of a resource center for individuals looking for other clinics, other providers, as well as for other clinics who are trying to start PrEP services. So that, I think, is probably one of the things I'm most proud of. So ways to get involved with the clinic: take my class. Do it. I only have 5 students this semester, and we're sad and lonely. I think there's still time to add, I'm just saying. Another one is just to volunteer. If you check out our website, and you can even just type in, I think, 1917 into Google, and it'll pull it up. Go to the Get Involved tab, and there should be a volunteer application located there. If you're interested in internships, I haven't posted the call for internships for the coming spring semester, but keep an eye on our website. I'll also post those in the purple briefcase hire blazer thing at some point. So check those out. And then there's typically 2. So there's one that's focused more on sexual health awareness through peer education, and the other one that's focused on HIV testing and counseling. What interventions or research has been done to combat stigma as it relates to getting tested, access to treatment. And actually 2 of my coworkers are here in the audience. Sally and Kiko work with me. They work primarily on the behavioral research side of things. So they have a lot of interventions going on specifically targeting stigma and other access to care issues. So several different interventions that have been developed or that are being modified for use in this area or in the South. There's a lot of research going on with the Center for AIDS Research and with several members of the School of Public Health faculty. Dr. Janet Turan, she is one of our leading HIV stigma researchers and has been working in Africa and then bringing those interventions here to use with our clients in the South, because she noticed that there are similar barriers and stigmas in both places. So if you're ever interested in that, definitely check out Dr. Janet Turan's work. Dr. Robin Lanzi in the Health Behavior Department is also one of the co-directors of the Community and Behavioral Science Core of the Center for AIDS Research here at UAB. And so they're both working on different research. One of the things Dr. Lanzi has been most passionate about recently is faith and spirituality and how that impacts stigma and HIV. So their faith and spirituality network is growing, and if anybody is interested in that, definitely contact Dr. Robin Lanzi.